Good afternoon, class. My name is Mireya. I'm going to talk to you today about a CYP450 metabolism and how it affects the psychiatrist prescribing. The prescribing psychiatrist condition may involve identifying whatever a patient is not experiencing enough drug exposure, too much complexity of the illness, and or failures to follow the prescriptions. We have the first analytic point that should be made for CY450. Variation does not directly impact psychiatrist outcomes, but rather impacts on exposure to medication. The first analytic point that should be made is that variation of CYP450 does not directly affect psychiatric outcomes, rather it affects exposure to medication. Antidepressant, antipsychotics, and mood stabilizer are metabolized for different types of CYP, 2D6, 26, 2C19, 2B6, P1A2, and other two more. An inner variation may move patients between poor, intermediate, normal, and rapid, and ultra-rapid metabolized phenotypes. This difference is significant because that better effect in one person who is poor metabolized may happen when he or she receives the standard dose, whereas the standard dose may give less benefits and or less exposure in another person who is in rapid, ultra-rapid metabolized. The second analytic point is that phenotypes must not be treated as fixed substitute for the patient's current metabolic phenotype. Alchi emphasized the importance of smoking, age, and pregnancy as other non-genetic factors that can modify the CYP450 activity. The third analytic point is that the strongest clinical argument for CYP450 informs psychiatric prescribing concerns safety, tolerability, and a rational dose adjustment. In a study of patients receiving treatment for major depressive disorder, adverse drug reactions were correlated with the combined functional status of the CYP2C19 and the CYP2D6 pathway, further supporting the clinical relevance of assessing two pathways as a single entity rather than viewing each gene alone. In conclusion, the CYP450 metabolism affects psychiatric prescribing by connecting genetic variation, environmental modifier, and drug interaction to psychotropic exposure. The evidence supports a balanced position. The CYP450 data can guide dose selection, anticipate adverse effects, and explain some patterns of non-response, but they cannot replace psychiatrist assessment or longitudinal monitoring. The most clinically advanced application of CY450 pharmacogenomics then is not in the selection of algorithms for medication. It is a cautious, evidence-based approach to prescribing that minimize avoidable harm and optimize patient care. Thank you so much. If you want to more disclosure of this mini podcast, you can go in to my discussion. Thank you so much and have a good night.